Welcome back to the morning edition. The number of COVID-19 cases remain at 14, but over 200 people are in quarantine here. With us to discuss the numbers and what's being done by the health team is Deputy Medical Officer Dr. Delon Brennen. Dr. Brennen, you're certainly not a stranger to the morning edition, but as usual, good morning. Now, I understand you're a part of a task force. Tell us some more about that in terms of the surveillance.
Sure. The Ministry of Health has a team of surveillance officers, which would include physicians, nurses, and other support staff that are out there making sure that we are searching out where the cases are, looking for the contacts of those cases, looking to see are there other people who are having symptoms that we just haven't presented themselves to medical care, and we are trying to make sure that we have enough testing going on to make sure the Bahamian populace is protected, but also that those people are taking on the measures that are important to make sure that they're not then acting as vectors to pass it on to others as well.
On that note, how is contact tracing? How is that going?
I think our efforts are going very well. I think it's a two-part or a two-pronged approach. One is making sure that we get as many contacts from each of the individual cases that we know so far. And so for each of those cases, we try to make sure that we find out where they live, where they work, if they socialize anywhere, if they're going to church, if, all of those activities that may have happened either during the course of their illness or prior to even when they knew they had symptoms. And then once they give us a sort of a round number of those people, they can then, that's just a general count of people, then we try to drill down to actual phone numbers or email addresses and how we can get in contact with those people. Once we do that, then we actually send people out, or we start making phone calls to get in contact with them. We find out how they're doing, do they have any symptoms, do they know anyone else in their area who's been sick, and then there are times where we need to go out and visit them as well. So we may send out members of our team to go in and actually do temperature checks with them if necessary, and if they have major symptoms, then we may need to actually do testing at that time. So it's really a social distancing kind of approach where we will do phone calls or even WhatsApp messaging or video conferencing with them, but then if we need to go in, we make sure our healthcare providers are protected, but they may actually need to do visits with people as well to, one, make sure they're actually in place where they're supposed to be, but also to then physically check on their status as well.
How compliant have you found those who are being tested to be in terms of being self-isolated?
I would say the majority of people who we come into contact with, more than 95% of people, are in place where they're supposed to be. I think the fact that the government has rolled out these additional policies of, minimizing the people who have to go out to businesses and closing down, restaurants and places where people would socialize has added to that fact. And so now people tend to be at home or very close to their home. They may be in their yard, they may be at a relative's house, but some close relative. And so what we try to do is make sure that people understand why it's so important that they're not out and socializing, because not only could they be a contact, but they could be a case that is asymptomatic. And regardless if you are well during that time period, if you're not at home, you have the ability to then spread it to others. And so a lot of it is really just education. It isn't a lot of healthcare that goes on with that contact. It is really public health education that goes on and letting them know why it's so important. You bring up another point in terms of people going by, let's say, close relatives. The Prime Minister just made the point that COVID-19 is now, we find in the Bahamas community, spread. Is it time to put further restrictions on who we can come in contact with? I know we've closed down the restaurants, the shopping plazas, churches and everything like that, but is there any way to further restrict who we come in contact with? I think it's very difficult at this stage for us to be able to restrict even more. I think we put in the appropriate policies. It's really one, enforcement of those policies. I think people still need to get food. In order to get food, you need money sometimes to get to get it. So I think the fact that you need to have cash on hand or be able to transact in that way means banks, or at least access to money, is going to be important as well. The fact is, realistically, it isn't just about the policies. One of the statements that's often made is you can't legislate morality. Right. You really have to make sure that we as a people are taking seriously the policies that are put in place. So if we want this to stop, if we want to be able to move back to a regular lifestyle, we want to be able to go out, go to entertainment places, want to be able to go to the beach, one of the things you're going to have to do is make sure during this time period we restrict those activities, we restrict our own movements, because it's only us that can make that difference. No amount of legislation is going to change that. But if we say we're serious about stopping the spread, the virus isn't just going to jump from one person to the other. It requires our movement and being around other people for it to propagate. And so if we stop that movement, we can realistically let people run their course of disease without infecting anyone else. You would have halted the transmission, and we could realistically, within a few weeks to a few months, go back to our regular lives.
How are things going on the family islands in terms of contact tracing there?
The good thing is right now we only have known cases in Grand Bahama. And so while we are still continuing our surveillance activities throughout the family islands, especially our major family islands that are known to have not just Bahamian residents there, but they also have visitors who may have come in and now aren't necessarily easily able to transit back to their own homes, our healthcare providers on those areas are very vigilant about making sure they screen, they are assessing people's symptoms, and if there's an issue, they then address it from there. They let us know from the national level, and if they need additional testing supplies, if they need additional equipment to be able to help them out, then we provide it from that level. But it's sort of a spoke and wheel, and so that we send out resources where necessary, but we don't want resources to be out in a particular area and have to recall those in order to send it on, because that would cause a delay. So I think it's going well. We can always look for additional issues, additional holes in the system, but as we find them, we try to plug them so that we can be as efficient in our methods as possible.
There is a concern, I see it online, that COVID-19 can fade away in the summer months, in the upcoming summer months, and perhaps make a possible return later this year in the fall. You want to speak to that for us?
I think what we see a lot of times with just respiratory illnesses as a whole, I won't say specifically for coronavirus in particular, but in this coronavirus, because we're still learning so much about the epidemiology related to it. But when we look at other coronaviruses, even the common cold, which can be caused by a coronavirus, and other viruses like adenovirus and rhinovirus, what we see is there are times in usually seasonal where you have more infections, and then it kind of tails off. For us, it usually happens during the summertime, where in tropical areas, people just aren't in the same places, they aren't crowded upon each other. So it's not necessarily a weather-related thing, except that when it gets cold, people are more likely to huddle indoors and be closer to each other, and it makes it easier for it to spread from one person to the other. Whereas during the summertime, people are less likely to be indoors. They are outside, they are enjoying the outside, and they are more likely to be spaced out from each other, and that allows us to not necessarily pass the viruses or other microorganisms on from one person to the other as easily.
What's the state of those in hospital here? I think there are 2?
Correct.
Are they still stable, and when is it anticipated that they would be released?
The 2 persons who are in hospital right now are very stable. They are requiring minimal amount of support. So we provide them with oxygen as needed. They may get IV fluids, just making sure they hydrate, they get a good diet. There's no particular medications that we are giving to them because there's just no real treatment that has been proven at present. There are lots of things that are being trialed around the world, but right now, we're just making sure we support them through the course of their illness. Much like our initial case that was hospitalized, they continue to be stable and are improving, so we're hoping and praying that they continue to do just as well, and we expect that, within another few days, as long as they continue on the same track, they too will be able to be discharged and go back home and then continue to convalesce there.
Now, this must be taxing on you and your team. How are you guys dealing with it in terms of, not just in terms of protecting yourself, but having to go home to your families and your mental health, keeping that stable, all of it?
I think it's a fine balance between putting in the work. I think much like any other workplace, there are times where you're busier rather than other times. And this is what we live for. This is what we work to do. So as public health officials, it's unfortunate, but when you have something like this happen, this is when you kick into full gear. You use all of your training, all of your expertise, your ability to learn information quickly, and then apply it in the field to be able to train others to appropriately address the healthcare need as well. So whether those are people giving acute care, whether those people who are doing data management, those who are doing research around it, you try to make sure that everyone's on board with the same aim in place, is to get us to the end point with as minimal amount of disease that affects the population, and with as minimal side effects and unfortunate, whether that is morbidity, having people suffer, illnesses that are secondary to it, or death, to go along with it. We want to minimize those effects. So we're out there, and we're grinding every day. I mean, it hasn't been a day off for the Ministry of Health and the Department of Public Health in the activities. But the thing is, what we're seeing is we're seeing the effects that go along with that. We know that the policymakers are taking it seriously from our advice, and they're putting in policies to help us. We know that the acute care providers are doing their job and training each other and delivering services that we know are going to slow down the trend and take great care of the people who are in front of them. And we're making sure that the community is informed as well, because while it is a very stressful situation to see things around you sort of shut down, the world around you shut down, it's being informed that lets you know why that's happening and what the trajectory likely is, and to see recovery happening in some countries. Let's say China, where this was the big worry and where we were, concerned about it and teaching people this is what could happen down the road. But now when you see China is making recovery and they're getting back to normal life, while you may be going through it at the time, you know that there is some sort of light at the end of this tunnel, that things will get better. It's how we treat each other, how we pay attention to the policies and actually implement them, that's going to get us either going well to that light at the end, or will we suffer a lot of issues and disease before we get there.
You talk about stress. One final question. What do you plan to do once this is all over? The first thing you're going to do?
I think once the opportunity presents, I'm jumping on a plane. I don't know where I'm going yet. I would love to go to just a beach on a family island. I will continue to social distance and be there, but just to be able to get away for a little bit would be much appreciated.
Well, thanks again. That's Dr. Delon Brennen.